Record. Great. Thank you, team. So here's just a quick overview of our agenda. We just had some time for a welcoming and opening. We will kick off partner presentations in just a few moments. We'll also offer an opportunity for reflection and closing. And as I mentioned earlier, our workshop concludes at 12 p.m. today. So it is my honor to introduce to you all Jeff Davis, who is the Executive Director of the California AfterSchool Network, to get us started with our presentations. Take it away, Jeff.
Thank you, Melissa, and thanks for folks for being here today. So what are we going to be doing today? Today, we're going to be centering and sort of beginning our workshop with one human being and one family, and we're going to examine and hopefully increase our understanding of the human impact that the opioid crisis has had in our communities. We're going to consider how these impacts are actually systemic through an examination of the social determinants of health. And then we're going to explore how a robust, publicly funded, expanded learning infrastructure, one that exists in every California community, can help to mitigate those types of impacts and be part of a solution. And then finally, we'll share a little bit about the California AfterSchool Network's journey through California Youth Opioid Response Year 1, California Youth Opioid Response Year 2, and this being the California Youth Opioid Response Year 3, or what is called shorthand YOR 3. We'll end with sharing a whole host of resources that we've picked up along the way that you all can use in your practice to educate families about the dangers of the opioid crisis and fentanyl, how to save a life by accessing and using Naloxone or Narcan, as well as all of the sort of the resources that we've gathered in terms of how you can support folks positively in terms of mental health. I also want to call attention to another webinar that we've done as part of this project. This is a webinar where we did a little bit more of an examination into the opioid crisis. We're not going to provide sort of high-level overview of those of the opioid crisis in this workshop. We did that in the other one. We're making an assumption that you all are showing up knowing that the opioid crisis is real and that something needs to be done to address it. We also talked about, it has been our experience with youth opioid response that there are many in the behavioral health, mental health, substance use intervention and treatment communities that are challenged to partner with schools. And for all the reasons, right? To provide access to intervention oftentimes means a reduction in instructional minutes. However, partnering with an expanded learning program, a program that has sort of the ability to use its resources and time flexibly, is a real opportunity. And we really explore this opportunity in that prior webinar. And we look at how county offices of education can be a way to sort of reach regional expanded learning programs at scale. So that's kind of what we do in that workshop. So want to sort of call your attention to that. We'll at the end talk a little bit about the expanded learning system, but if you're not familiar with California's $5 billion system of expanded learning programs that exist in every California community with funding to every local education agency, also known as school district or charter school, right? That is a real resource for you to access. As for today's workshop, as I mentioned, we're going to be really centering around the human experience. We're going to contextualize that in our social determinants of health, and then examine the role that expanded learning can play. So it's my honor to welcome Sheila James. Sheila is a friend and colleague, and Sheila, I just want to begin by thanking you, right, for your vulnerability today, for sharing your lived experience so that we can learn. And I also want to share with our participants that we're going to see a video that was pre-recorded with myself and Sheila, and that we really did this to hold Sheila with emotional safety so that she could have a space to tell her story. Her emotional safety was our value in this process. Um, and I also just want to share that what you'll be hearing is about real lived experience. I'll say a little bit more about that in just a moment. But I also want to share that as we were moving through this and really checking in with Sheila on, is this safe for you? That one of the things that Sheila did share with us, that telling the story is often part of a healing journey. So Sheila, I just want to open it up to you to say anything that you would like to about that at this moment.
Thank you, Jeff. The main thing I will say is, again, thank you, because a part of the healing process is being in spaces where you feel safe enough to share your story. And we were at a random event having a random conversation, and one question led to me sharing a little bit of everything. And the important thing was that you held that space so that I would feel safe and comfortable, and I had the room to share. And for that, I thank you. This has been a healing journey for me. I'm still evolving, still learning, but this is definitely a part of the space I'm in, and I'm grateful to be here because I am still healing.
Yeah, thank you again. Um, and in a moment, we will play the video of Sheila and I's conversation. And really, this is really all about Sheila's story. Before we play the video, I do just want to be really clear with our participants today that this is about real life, real lived experience. There are going to be very sensitive topics that you can see listed out on your screen. We want to put this out up front because we know that this could elicit emotional response. This can be triggering. So we are encouraging folks to do whatever they need to do in this moment to take care of themselves, again, with deep gratitude for the generosity of Sheila for sharing her story. Um, and that's all I'll say about that. And I'll ask the team to go ahead and move us to that interview now. We're really honored to welcome Sheila James into the space. Sheila, just really wanting to thank you for being here, for sharing of your lived experience, and for your vulnerability. And to our viewers, you will be hearing about a lived experience that may be triggering. And we wanted to make sure that we did this in a recorded space. And we really did that to create a safe container, Sheila, for you to share.
Well, thank you, Jeff. I typically don't share my experiences unless I feel comfortable and safe, but sharing is a part of my own personal healing journey. And I am very honored and humbled to be able to share this with you and your listeners.
Thank you again. And so Sheila, you know, as we've gotten to know each other, I've come to the understanding that you and your family have gone through a lot of personal trauma, including a loss due to a fentanyl overdose. And you just share challenges that you have experienced.
Thank you. So my story is a long one, unfortunately. I lost my oldest son in 2005. It was a violent death, unfortunately, and that really shook our family to its core because we never lost a child or someone so young. He was only 23. So we kept moving, not necessarily healing, but moving, and doing all of the things that you would expect people to do, working, going to school, you know, etc. During that time, as a wife and mom, I tried to be strong for everyone, making sure I was there for my husband because he had lost, you know, our oldest son, his namesake, being strong for my other 3 children because they had lost their big brother, just doing all the things that moms or women are supposed to do. And then lo and behold, exactly 10 years and 2 weeks to the date, we lost my youngest son. He passed in his sleep. He had been drinking and hanging out with his friends. He was on shutdown from his job. He worked full time, and he unfortunately passed in his sleep. And that was, I guess I could call it my breaking point. Although after he passed, I continued to be the strong Black woman and was supporting my husband because this is the second son he's lost, supporting my daughters because now they had lost both of their brothers. And at this point, also now supporting my grandchildren because my oldest son, when he passed, did have a 3-year-old, and my son had sort of stepped in to be that male figure for him. My other daughter had 2 children, and he was, you know, the perfect uncle, the fun uncle. So being strong for all of them led me to a place where I hit the wall, and realized that being the strong Black woman and all of the things that I had witnessed through the years from my ancestors, grandmother, aunts, was not working for me. And at that point, I know I needed to make a change.
And Sheila, when your grandson passed in his sleep, my understanding is that that was due to a fentanyl overdose.
No, that's the other half of the story. That was my youngest son who actually passed in his sleep. And then here we are, 6 years later, my grandson, the son of the oldest son, actually passed of a fentanyl overdose. He was smoking marijuana, went out, brought his marijuana, pulled up in front of his mom's house, was waiting to go inside smoking, and he didn't wake up. He fell asleep in the car and he didn't wake up. It was the first time in my immediate family, my husband, my kids had ever dealt with the things that we hear and see on the news and in the papers. I mean, we've all heard of fentanyl overdoses and just how dangerous fentanyl is, but to experience it was a completely different lived experience. It made me become a bigger advocate for mental health in the African American community, because without that lifeline, I don't think my family would have made it. I don't think we would be functioning and healthy as we are today.
Hmm. Can you say a little bit more um, about that decision-making process around seeking help and the role that stigma played in that process?
Well, unfortunately, in the African American community, um, mental illness and seeking any type of help when having mental health struggles was one of those hidden things. There was a stigma. Oh, you're crazy. You don't need to go to a crazy doctor. You just sort of dealt with it, and you had to look at the other traumas that centered around the mental health stigma, race-based trauma, emotional trauma, because in some families, sharing emotions can be dangerous. Um, like you can't show that you're weak. Black men especially, it was hard for my husband because he's the black male, the head of the family. So at this point, losing my grandson, um he was at a point where he needed the help, um and he had to let go of the oppression that goes with seeking any type of um help from outsiders, um, resources and access, and the other piece is finding therapists who look like us, because there's again that stigma. You want to have these conversations with someone who understands your lived experiences as a person of color. And finding, and I guess I should say now, we have apps with Black therapists that you can reach out to, or therapists of other nationalities. So it's a lot easier, but that stigma still is still there on the other side. you know can I do this? I'm not crazy, nothing's wrong with me. um just being comfortable to reach out and ask for the help.
Yeah. It occurs to me as well as we've connected about this, that you've also shared, right, in terms of there's that aspect of reaching out to outsiders, but then there's also this notion of reaching out to your community, and the various responses that you got from your community when you did sort of seek help from your peers. And
Mm-hmm. I think people as a whole, they want to be helpful. They want to provide support, but they really don't know how. I specifically remember when my grandson passed, my best friend of 20 something years, she, reached out, and she was crying, I was crying, and she said, I want to help, but I don't know what to do. I don't know what to say. Um, and I said, just listening to me is good. And I think sometimes people say things trying to help, and they really aren't. Like, when someone tells you, oh, at least you have 3 other kids, or, oh, God needed an angel, so he took your kid. They sound good, but they can be rather hurtful, because I do specifically remember someone saying that to me, and I actually responded and said, well, they should have took one of your kids. And it sort of jarred them a little bit, but later we were able to have a conversation, and I explained to them that sometimes you don't have to say anything. Just telling the person, I'm here, I want to listen. Even sharing stories about their loved one can be helpful. I know when my son died, having his friends come around and just talk about him, to me, was very healing. We even had one young man who would come to our house and sit and watch TV with my husband for, I think, almost 8 months. That's all he did, was just came and sit and watch TV with my husband. Sometimes they talked, sometimes they didn't, but he was feeling that presence. And those are the kinds of things that people have to be comfortable doing, and be comfortable with the silence and just being that listening ear. So the person who's grieving has an outlet.
Yeah, yeah. Well, thank you for sharing that. And I'm aware that, you know, many of our folks that might be viewing in, or they're from an education system or a health and human service system or a substance use intervention and treatment system. And what can folks that are working in these systems do to create those types of conditions of safety and trust, so that folks can access that kind of support when they need it?
Well, because I'm in the out of school field and everything I do is centered around working with adults who work with youth, we'll start there. And that is exposing our youth to these types of careers, and helping them to learn that people who are in these professions are there to help them, and that it's okay to ask for help. We have to start when they're young. But then for those who are in other positions, you know, creating training programs that are training our folks who are going into these fields, you know, how to work with people from other cultures, trying to create a workforce that's more diverse, um, helping people in these fields address their own biases, and any policies that they may have that can hinder people from stepping out and asking for help. Um, Creating safe spaces is another one, and that's at the top of my list. People have to feel safe, and feel comfortable. Again, for myself, I know we talked about this one of our conversations, and like I said, I have tattoos on my arm. One of them is of a waffle, and Waffle was my son, and people will mention it. Sometimes I will share, sometimes I won't, but I have to feel that it is a safe space. And so we have to help adults and those in authority learn how to create a safe space so someone can feel safe. What does a safe space look like? What does it feel like? And then promoting mental health education in our schools, and in our out of school time programs. And, you know, again, going back to the youth, helping them to understand it's okay to reach out for help. And it doesn't mean that you're weak. It doesn't mean that you're less than. It just means that I'm in a space where I can't do this on my own. I need somebody to help me go from this spot to the next. Um, and the person who's doing it has to be able to understand where that person is coming from unbiasedly.
Yeah, yeah. Thank you. Yeah, I mean, as we've discussed, I mean, grief is just a real dark valley. And we all need help getting through that.
There's a quote that I actually keep it on a post-it note on my computer. And it says, when you survive loss, everyone is quick to tell you how strong you are and how tough you must be. But actually, no one has a choice to survive grief. It's not optional. You just have to cry in the shower, sob in your pillow, and pray you will make it. And that was by a person named Zoe Clark Coates. And someone shared that with me, and I literally keep it on my computer because, you know, here I am all these years out, and, you know, grief comes just like the weather. Some days it's sunny, some days it's not, and you have no control over when you're going to be impacted by those losses.
Sheila, is there anything else that you'd like to share that you hope people will take away from your experience?
Just realize, if you are a woman and you're listening to this, let the stigma that you have to be strong go. You can't fill anyone else's cup if your cup is not full. You don't have to be strong for everyone. It's okay to ask for help. It's okay to say no. It's okay to take time away and refill your own cup. And if you're a male, it's okay to ask for help. It doesn't mean you're any less of a man. It doesn't mean that you're not strong. It doesn't mean that you're not providing. It's okay to need help.
Well, thank you so much, Sheila, for your generosity, your vulnerability, and sharing. This has been really real. And I just want to thank you for your generosity.
Thank you for having me. And thank you for allowing me to share.
Well, thanking you again, Sheila, for thanking you. I know that just experiencing that again has been an emotional experience for me. I just want to offer you one more invitation to share anything that you'd like with our participants here today, including other ways that you've been healing and telling your story since that interview.
Thank you. I had mentioned this to Jeff and his team when we were in the green room. This whole process today really is a part of my journey. The anniversary of my grandson's death was Monday. My oldest son, who passed, his birthday was in August, and my youngest son, who passed, his birthday is in October. So there are 3 months where I'm all in the fields. And from that initial conversation with Jeff, I literally started thinking, how can I help other people more? And for me, it is just sharing my story, helping to bust the myth that counseling is this taboo thing, or that you should be ashamed of your mental health journey. So for me, I'm starting a blog to talk about how grief and empathy has changed my way of looking at life, at looking at the out of school time educators that I train. I am using this journey as my foundation to try in whatever little way I can to help people take the steps that they need to heal. So many of us are dealing with the things in our spaces, and then when you bring in things like substance abuse and mental health, it's sort of like it piles it on. But in order for, and I say us collectively, to have youth who are resilient and ready to go out to conquer the world, we have to make sure they feel comfortable accessing the tools and resources that are out there for them to feel whole within. And that might look different for everyone. But this is definitely a journey. And I encourage everyone and anyone who is listening, even if you're not ready to go to counseling, seek out a friend, someone who's a safe space, where you can share and just dump, so to speak.
Thank you again, Sheila. And, it's just a reminder, right, that life is hard. Grief is hard. Coping is hard. And some of the ways that we end up coping as we try to heal aren't always healthy.
Right.
And sometimes we even need to heal from our unhealthy coping. And in all of that, we hold that love is a research-based approach, and that love is the way that we get through this. I'll just offer one more space or opportunity before we take a brief pause if there's anything else you would like to add, Sheila.
Just, I can't stress so I'm gonna side note for a minute. When we originally made the video and I went back and watched it, I thought about so many things that I didn't say that I could have said. Like I said, this has really been a journey. And for anyone out there who is dealing with grief or loss, substance abuse, just know that it's okay if things aren't okay within a day. Don't put a timer on it. Don't say, oh, well, it's been a year, I should feel better. My oldest son has been gone, almost 20 years. I still cry. It's like this roller coaster ride where you're on the ride and you go up the hill as you're getting closer to the date of the event. And then you get to the date and then you go down the hill and then there's a holiday or then there's a birthday or then there is my trigger this month was a friend was talking about some of the things she went out and did with her sons, a mother-son date. It sent me into, I call it my box. But that's okay because I had the tools to help me get back out of the box. So just know there is no timeline. It's not going to change overnight, and that's really okay. And it's okay to ask for help.
Yeah, thank you for that reminder that the healing process is a journey, and that's a journey that never stops.
Right.
And so we're always on that path, and some days we feel better, sometimes we feel better, but that doesn't mean we're done, right?
Right.
We're never
Right.
done. Thank you. Okay. We are acknowledging that that was impactful and heavy, and so we're just going to take a quick break. We're going to play some music for a couple of minutes. We're just going to allow you all to breathe and process for a moment, and we'll come back in about 5 minutes, and we'll move on with the workshop. Thanking you again, Sheila.
Shit.
And welcoming folks back from our brief pause, and just reminding you of our journey today, that we're grounding in the human experience. I know that, right, there's always all these opportunities to hear about statistics and things of that nature. It occurs to me in this moment also, just like raising the importance that this is also Suicide Prevention Month. And so just raising the importance that these are all more than statistics, that these are real human experiences that that people and families are going through as a result of all of these challenges. And we wanted to contextualize this as well, that right, wanted to really look at how these experiences exist within the context of the broader society, and really honored to welcome Rachel Castaneda, who's a professor of psychology, and you can see sort of her credentials with the two universities that she's working with, and wanted to really just contextualize human experience within the broader social determinants of health. And then from there, talk about expanded learning and California's expanded learning system as something that can mitigate some of these impacts. So Rachel, thank you so much for joining us today. And I will turn the floor to you.
Great. Happy to be here. Thank you so much for inviting me to this space. Sheila, I just have to say that I am just so grateful for you sharing your story. I have a similar story to an extent, right? I think we all can relate. I saw that in the chat. And so I just applaud that, just because it's very hard. In terms of families experiencing, individuals, families experiencing substance use, we don't know what to do with it, right? We don't know how to process it. We don't know how to talk about it. We don't know questions to ask. We don't even know about it. And all of that keeps the layers, right? Keeps us hard, keeps us mad, keeps us angry, keeps us quiet, keeps us powerless. And what you did is so instrumental, talking about it, learning about it, right? And to shift away into breaking free from that captivity. So just thank you. What I'm going to do today is one of the ways that I have in the research that I do for decades has been shifting away from a moral, criminal, social model of how we contextualized substance use, and really shifting it into a health or a public health model to really ensure that we are shifting away from shame and stigma. And this is important. This aligns with the goal around what the California AfterSchool Network is doing, and really honing in on areas that keep us captive and keep systems captive and keep professionals captive, is really not knowing what it is and how to deal with it. And so I'm going to give you a tangible way to do that. I'm going to integrate this health model to help us set that stage. just as I said earlier, I am from El Monte. And for those of you that don't know where El Monte is, I saw some in the chat. Some are from Whittier up the way, in LA and all sorts of different places in California. In LA County, we are put into these spas, not where you get massages, but service planning areas where they identify a need based on census codes and zip codes and tracks. And so El Monte is in the number 3 here. In LA County, there's 8 service planning areas. And this is helpful from a county public health department. I think I saw somebody from the public health department in LA County to really recognize the nuance and the needs that vary, right? And I, like Sheila, and many of us probably can relate. I grew up in this inner city community. El Monte is where there's not a lot of resources. There's 6 high schools. It's a big city area that's broken into like north, central, south. But right, I just grew up in this inner city community, and there was substance use was highly prevalent. Given access, right, given areas of access, the community was heavily saturated with liquor stores, and now we have smoke shops, right? And I grew up with also family intergenerational trauma where my mom and my dad, so the upbringing was very difficult, right? Where we grew up very kind of poor, if you will, but we didn't kind of know it until you know it, right? Until I went to school and shifted and I went into like a different spa maybe, or drove up a different way. But within that environment, I just grew up with a lot of stressors. Stressors, seeing my mom and dad suffer with some health challenges, mental, physical, and then me and my brothers just kind of navigated towards what kind of made us. There's stressors there and layers. And my brother also overdosed on methamphetamine. My younger brother, my older brother had several DUIs, alcohol, and imprisonment, where I would just go to Wayside as just a facility to visit. And so, just like you, Sheila, I feel like there's just layers with it. And then family cultural barriers to just how do we understand like service? Like, is there service for this? Because nobody talks about alcohol and drugs. Like, and if you do, it's like happy and like happy hour time. But other than that, when it goes bad, how do you talk about it? Right. And so I was dealing with this as well. And one of the issues, um, if you click, there's some animation. Thank you. Um, people that go into treatment in LA County, this is just a snapshot of LA County. We look at admission and discharge. And so I've been able to work with LA County, and this is just accessible on their website as well for those of you interested. And it just kind of gives you a snapshot of like the trends of substance use in the county. You could probably find it for your various counties that you're from. And what you'll see is similar trends, that there's a lot of substance use, right? But there's not a lot of effectiveness of how we would view it. What that means is people are leaving treatment or staying in treatment, and they're continuing to use alcohol and drugs. That's positive compliance is always hovers around 50% or less than 50%. That means they dropped out early, they didn't retain in services, there's problems of engagement, right? Even within the specialty settings where you would think should be cured, should be fixed, that's where it's taken care of. That is not the case. And so this opened my eyes into this whole area of where I'm in, and what I'm going to be talking about is like we have to do things differently. We have to get better at understanding substance use, particularly among young people, because what we know is that it's a family disease, but it's also an adolescent onset disease. So we have to do better, particularly of those that work with young people. So if we could just keep clicking, just so everything comes up on the slide, great. So contextualizing Sheila's story using a public health framework, right? Shifting to focus on health. What does that mean? And so you'll see on the right-hand side, you will see health falls along a continuum. And so substance use is a health behavior, just like eating, just like physical activity, right? It could be adaptive, right? We take medications and we use recreationally according to laws, right? We don't binge drink. We don't, we manage. There's recreational tobacco and alcohol, right? We fall. It's 21 and older, and it's just one drink, right? There's health standards around physical activity and diet and sleep and screen time and substance use, right? And we understand we should shift to understand substance use as this core health issue. And when not that's influenced by multiple factors, right? Emotional, right? The stressors, the history, the cognitive. Cognitive, I just want to say something there. Developmentally, young people seek reward. Their brain is developing, and substance use has been shown and glorified in our community since I was little, right? That just means you walk up and down the street, you see smoke shops, alcohol shops, you go to the market, you see just aisles of it there, just glorified. You see commercials, you see billboards. Now with technology, with movies, with radio, with film, right? It's glamorized. There are instances where it's depicted in a negative way, but not so much. So the social norms around that substance use in a community is very positive. So cognitively, from a young person standpoint, that is no bueno, right? Behavioral, right? That's where we like to say, well, it's your choice and it's a behavior. You should cut it out. But there's so many more dominant influences, right? There's the physical, the developmental features of the young person, like hormones and developmentally just seeking reward, right? Seeking things that feel good, look good. In their spiritual aspects, social and environmental. So I want you to just kind of think about this question. How are health issues like substance use, like diabetes, like addiction, right? Like diabetes, like cancer, like depression, like suicide, how are they, if we take them all into a health context, how are they best understood? Right. And so one of the areas that has received little attention, we focus on behaviors. And when we do that with substance use, we really isolate it, where it's like the moral criminal model. Unlike other health issues like diet and screen, they don't have that tone. So it's really dangerous to leave substance use within the behavioral model. And research just doesn't simply support that, just with all others. So, what we're going to look at are what are the major drivers, predictors, sources, influencers, right? Social media, what are the big influencers that predict trajectories towards poor health outcomes, right? From taking a behavior like eating and diet and exercise and shifting it along this continuum to signs of illness, signs of issues, signs of risk, chronic illness, disease, then death. What are those, right? Same thing. What are the drivers? And so research has shown, and we have a lot of it growing, is it's complicated, right? What determines somebody's health? That's this model here. Determinants of health is basically how is your health determined? How is it best understood? And what we know from the current research to practice in the literature is when you do statistics and you put all these factors in a model, behavior, these individual level factors in biology, and social factors like your family and your peers, and then these environmental factors like policies and access and the built-in environment. What comes out of that model is these policy and interventions. These system level factors are the drivers, these environmental level. And these are called social determinants of health. These are social, and it's broken up into the social environment, the physical environment, and then the larger systemic, like our policies and our access to care, right? Our insurance, our access, our resources. These are the main drivers. Like if you put everything in a model, sure, behavior and biology and genetics is important, but the drivers, the ones that are the leading indicators that are going to reinforce continued disparities if they're not thought about and if they're not addressed in our models of how we deal with health and health issues, you're going to be ineffective. And so this is just one of the drivers of substance use and overdose in LA County is income and housing, right? You're going to see some of the social environments, things like early childhood experiences, right? We call these ACEs, unemployment, housing instability, the effects of racism and discrimination. All of these increase risk for poor emotional and cognitive issues that then increase substance use, right? And so it's these emotion regulation as these cognitive regulation issues that then, right, if you think about impact of COVID on emotions and cognitive, right, and then behavior. So it's these environmental issues that will then increase poor emotional and cognitive with young people in terms of development that will then drive the behavior. It's not just behaviors in isolation. And so here are some examples and some quotes. I love the quotes. And so you can know your health by your health status by your zip code. This is by Kaiser Permanente. The U.S. Department of Health and Human Services says health starts where people live, learn, and play. And health is best understood by systems and services offered and engaged in, right? According to the research, when you take a social determinants of health model. So let's consider, you're all from schools. Let's consider how school systems are responsive to youth substance use as a health behavior. What do I mean by that? So let's just think about what is from a social determinants, these factors and these indicators. What does access to services look like? Are they quality based? Are schools giving interventions and programs that are evidence based, right? Designed and shown by research to effectively address, prevent, intervene with the youth substance use? Are school systems offering equitable policies that address substance use with parity? What do we mean by that? They're addressing substance use the same way they address health issues. Like if a student gets sick with a cold or COVID, right? There's immediate response. Or if a student shows up with a mental health concern, what would the response be there? Is there parity? If a student shows up with substance use, what are the policies in place and protocols of how you respond? Is it up to par with these other medical and psychological issues? If you just think about that from, your school settings. So as you think about that, are you providing in your school system, providing services and policies and programs, right? What is it? If you had to think about it, what is the policy? What is the program? Is it effective? You're all going to start kind of, uh-oh, I think we're in trouble. Uh-oh, because you're all probably thinking, well, whose responsibility is it? Right? Whose responsibility is it? According to the Health and Human Services, because substance use is a health issue, we're all responsible. Wherever youth are receiving care in services, so in school settings, that means you're responsible to integrate models that integrate their health. So that's physical, mental, behavioral, right? Equally and equitably and effectively. So let's just see how we deal with substance use. Some case illustrations. Steve and his friends bring a water bottle filled with alcohol to school and a teacher smells it in class. What was his response? Henry and friends are found smoking weed in the field at lunch. What's the response there? Linda and friends carry vape pens with flavor and it dropped from a backpack in front of an administrator. What would be the response? Emily and friends are using Adderall in the bathroom during PE and a teacher walks in. What's the response? Johnny's prescription opioids fell out of his pocket in the weight room and it was flagged. What are the responses? There's various places, an administrator, a teacher, a coach. How do these systems respond? In California, you might be thinking, well, we don't respond. We just ignore. Is it ignored? The typical response is punitive. In California, under California Education Code 48900, it's a suspension or expulsion. It's actually left up to the discretion of the principal. So it's kind of like depends. It depends. And it would be like maybe first time it's a detention, maybe second time, another detention, third, we might have to warn you about suspension and ultimately you have to leave the district. You have to leave school. If you think about, right, that is the response. But if you think about if they are in detention or they might be kind of offered some kind of class, maybe, what kind of service is it? And when we review what kinds of evidence-based prevention programs are offered in school settings, it's a mixed bag. There's not a lot of resources given. So it's DARE, it's usually some health education, maybe pulled from a website. It's typically not evidence-based programming. Just right. We are in California working on an evidence-based resource. So, more to come later, but we don't have much available, right? A lot of the response is war on drugs, war on people, substance use is bad. That means people who use them are bad. And it's this criminal moral model. And that's what kind of keeps us silent, isolated, shame, stigma. So what we want to do, right, is care about this. Why? Because if we don't, we are reinforcing poor health trajectories of young people. We are not getting at the thick of it. So I just quickly, there's going to lead to, this data shows that lead to systemic social issues that reinforce health disparities. It's going to lead to families, systems that are going to continuously experience that shame stigma cycle and pose barriers to services, right? Data from Children Now found that 60% of drug-related suspensions are boys. They're boys from disadvantaged students. They're BIPOC, they're youth of color, and they're also experience their sexual minority youth, right? And all of that, when substance use is involved, right, and it's paired with issues that are linked to stressors that youth have, emotional, cognitive, right? If you think about just gender minority youth, substance use can be highly correlated with a lot of the shame and stigma and bullying. And what if they are using alcohol and drugs? What if a young person is using alcohol and drugs, right? And it's linked to peer. What's the response? If we're not addressing it equitably like we do mental health and medical health, it's gonna lead to cycles of poor health. So what can we do? And so I'm gonna wrap up. I think I have like maybe a couple more minutes. Part of the issue is a lot of families and school staff, they don't know how to offer services to families, right, beyond the punitive model, because we don't have them integrated. So what can you do? And then Jeff's going to kind of talk about some response there where you can focus on social determinants of health. That's the effective response. You can integrate a social determinants of health model would say, well, what are your policies? Let's rethink them. What are your interventions? What is the access that you're giving them? That's a social determinants of health lens. You're thinking about the policy, you're thinking about your interventions, and you're asking, are we promoting a health equity system in our schools that are addressing substance use like other health issues? And so what this could look like, and then Jeff will take it away, is there's all sorts of efforts now. And like you could start with administrative, like, are you screening for social determinants of health? Are you integrating that within are you screening for substance use? And are you honing in on the behavior and leaving it isolated? Or are you really shifting to be like, well, what are the social determinants? What are the economic indicators? What are the housing indicators? What are the trauma, the family issues? Because that's going to, next slide, that's going to kind of help you get to the root of this. And so these are some examples. You'll get these slides. So Prepare and Kaiser, so the health departments and Kaiser and health centers are really shifting to really integrate social determinants of health and substance use screening and not just hone in on the behavior. Another thing is you have to then meet as a team, and who's responsible? Everyone in school, right? Administratives, nurses, counselors, teachers, coaches, PTAs, families, and your after school programming, right? Liaisons. And so how can you meet as a team to start thinking about using social determinants of health data and substance use and developing flows within your settings that take responsibility and really ensure care coordination and effective policies and effective interventions? Everybody has a role. And so Jeff's gonna now kind of take us through what that would look like in using the after school network that you are all in, and how can you kind of consider that. So I'm going to kind of leave you as we think about, you can put in the chat how can, now that you know what social determinants of health, shifting towards a health framework and really nuancing substance use as a health issue, and the main drivers of it are social access. We want to make sure, and how to address it are social determinants. So are you providing access? What do your policies look like? Are you using resources? What are they? So how can expanded learning play a role in this?
Yeah, thank you, Rachel, for that contextualizing. And what I really hope to do in the next few minutes is really to kind of create that bridge, right? We heard Rachel talk a lot about environmental features, and we refer to those as context, right? Or conditions. We talk a lot about conditions for thriving in our work, and the research-based conditions for thriving that our quality standards are grounded in. We talk about how those conditions for thriving are also buffers for trauma, and for those that are experiencing adverse childhood experiences. And we heard, right, that there's this opportunity to be in a space where we could be part of an effort to screen our participants for the social determinants of health in partnership with our school partners. That expanded learning is a time and place where intervention can take place. And it can also be a pathway to services in the community for children, youth, and families. And so I hope to sort of demonstrate that in some of these remarks, but also just say, like in my own experience, right? Why and how is expanded learning this uh, great pathway to other community partners and community services, and why are they a great vehicle for families? Anyone that's here from expanded learning, um, they know it. But in my own experience, I'm signing up for parent teacher conferences, probably one of two that I'll have all year with my kids' teachers. But I see their expanded learning staff every single day when I check them out. And they know me, they know my kids. That's where I really learn more about what's going on with them is from the expanded learning staff. Um, so, um, just wanting to share a little bit about the expanded learning system. Before the pandemic, California had the largest system in the nation. And currently, based on new investments, our system between three funding sources is in is a $5 billion system. It exists in every local education agency in the state. And what is expanded learning for those that are unfamiliar? In one sense, it's a time and a place. Um, and in another sense, it's a there's a spirit to it. And on the next slide, we sort of go over that this is before school, after school, summer, intersession, and that this is really about academic, social, emotional, and physical development, right? We talked a lot about health, right? In our quality standards, there's nutrition and physical activity as well, and that this is intended to be centered on the student, and also in partnership with communities. Um, Wanting to share just a little bit about the foundations of expanded learning. We talked about the protective factors or the context or conditions. And on the next slide, you can see that before that Bonnie Bernard, before we had our first grade expansion in expanded learning programs, wrote Resiliency: What We Have Learned. And in California, the sort of environmental inputs, right? The context, the conditions that she surfaced, we actually measure at a statewide level through the California Healthy Kids Survey. So this is data that we can access, understand, and even influence through our work. But she surfaced that when children and youth experience caring relationships, high expectations and opportunities for meaningful participation that meets the developmental needs of the person. And it promotes strengths that result in positive life outcomes. Um, so expanded learning, and just by generating these protective factors, are a mitigating factor for a lot of the social determinants of health and result in those positive life outcomes. What we have found as the research has evolved is that it holds true. And in 2019, the National Commission on Social, Emotional, and Academic Development did another sort of research roundup, and they incorporated the new research on neuroscience. And what they found was very similar and outlined in the framework on the next slide, that when children and youth experience safe, relationship-based, equitable learning environments, right? Caring relationships with embedded social, emotional, and cognitive skill building, high expectations in terms of rigor in terms of content and learning experience, high expectations, engagement, ownership, and purpose, meaningful participation, right? That these are the kinds of settings, contexts, and experience conditions that result in positive life outcomes. And this is the research base that is foundational to the quality standards for expanded learning in California. So simply by creating these quality conditions, we are, in a sense, a tier one support, universal support, and a buffer for a lot of the trauma that exists in our communities at a systemic level. What we like to say is that love is a research-based approach. And that doesn't mean that it's soft or fluffy or easy. If any of you are in a loving relationship, which I hope all of you are, you'll know that it is not easy. But to love somebody through things, right? To hold them to high account, to honor what is meaningful to them. These are the conditions that support positive development. So we really thought that this was the foundation of what could be a huge community health and wellness approach, was this center of expanded learning. In 2019, we convened a diverse cross-sector of folks with partnership funding with a youth opioid response planning grant around a vision that building on this system of expanded learning programs. We can see the opportunity on the next slide. We were exploring that this could be a vehicle for pathways to health, mental health, social service, substance use intervention and treatment, right? Addressing food security, which we know that we already do. And having met all throughout the pandemic, we created a statement of strategic direction toward equity-driven whole child health and wellness that includes a whole variety of strategies that can be utilized within communities in order to leverage expanded learning as part of this health and wellness trajectory, and to build interventions on top of the positive conditions we create. But during the pandemic, we also really realized that that we had to stop and think of things differently. And this is what Rachel was really surfacing, that we have to look at how the systems as designed were perpetuating inequities. We had to take an equity pause, and actually, instead of making folks conform to systems, we needed the systems to conform to people and communities. And through our youth opioid response in year 2, we were actually able to work in 2 communities and actually test out some of these strategies and create some navigation pathways that are able to sort of look at how do you build on this structure of safety and belonging and positive youth development, and then create more opportunity for intervention in critical services, right? And through this, we really realized that folks needed more information and awareness on how to kind of do this work and why it's important. So that's why we continue with Youth Opioid Response number 3. And this webinar is part of that effort. I had mentioned previously that we had done a prior webinar all about the opioid crisis, all about how to leverage and really partner at scale with California's expanded learning system. And I hope that you'll take a look at that, especially for those of our partners who are here from the behavioral health or substance use intervention communities. This is all nestled into a bigger California vision for transforming schools. It's also nestled within a whole ecosystem vision for the Children and Youth Behavioral Health Initiative. And all to say, I think now is the time to really shift our systems, increase our levels of collaboration to promote more community health. And, you know, the word opportunity is defined specifically as a set of circumstances that make it possible to do something. I think in California, we have a rich set of circumstances for expanded learning partnership to enhance the lives of our most vulnerable communities. And of course, we need some resources to do that. So I'm going to turn it over now to my colleague, Melissa, who can sort of round us out and share how we can access some of those resources.
Thank you, Jeff. We do have resources to share, and we also, I think our team, thank you, Leslie and Malia, who've been supporting behind the scenes, have dropped a resource in the chat that has all of the resources that I will share in a few moments. So if you are unable to scan a QR code or take a photo of something, you will have access to everything in these Google Slides, and also all the resources are linked in that one Google Doc that we shared in the chat. I just wanted to take a moment to thank Sheila James, Dr. Rachel Castaneda, and Jeff for a wonderful presentation today. We started with Sheila's brave and impactful story on giving us the opportunity as the participants in this workshop to really hear about a lived experience, and the lived experience on trauma and the impact of substance misuse, and how holding space, creating space, a safe space for folks to be able to navigate a lot of these challenging life situations is essential. And so wanting to say again, thank you, Sheila, for your vulnerability and sharing your and your family's story with us today. And then also thank you to Dr. Rachel Castaneda for sharing a really informative session on social determinants of health and how we in our communities and our educational systems can really take a pause and think about the policies and systems that we have in place to address any areas that impact how we're supporting children, youth, and families in our system. So thank you for that. I know a lot of our participants are eager to dip into some of those resources that you shared with us. And then lastly, Jeff, walking us through how impactful expanded learning, the role expanded learning plays in creating conditions for youth to thrive, and how we can also support our families in doing that as well. So what an amazing workshop. Thank you for sharing all of your knowledge and expertise with us. As I mentioned in the doc that we shared, on our website, we have a catalog of resources that you all, and you can share with anyone you want to share with, resources to support youth and substance use interventions, health and mental health. It's basically just a catalog of resources that we have gathered over our journey with California Youth Opioid Response. And so again, you will have access to this. Just wanted to say it out loud so that you know what's available to you. We also are helping promote the Naloxone distribution project. And so you definitely don't want to miss out on this opportunity. This is a great resource where folks can get free all-in-one fentanyl test strip kits. And so you can apply, there's questions, you'll have access to the slide deck to click on all the links. And we also have a direct link in our resource doc that we shared. And also, I'm just going to highlight a few key resources that we also highlight on our website. The Office of the California Surgeon General has put together a really great website that has webinars, toolkits, resources, information in a variety of languages on safe spaces, foundations of trauma-informed practice for educational and care settings. So I highly encourage you to review this particular resource. And then also, sometimes there's those questions that we don't know how to answer, right? And so there's a great app that folks can connect with. It's called Bright Life Kids. It's a project with CalHope. And so you can sign up for free. This is also linked on our website, and you'll have access to all of that. And as a partner with our Youth Opioid Response, we do continue to share resources that support health and wellness. We do offer a health and wellness newsletter, and so you can scan the QR code or click on the link in the resource doc that we shared, where you can join our mailing list to receive all the resources and information that we share in our health and wellness newsletters. And of course, stay connected with us. You can follow us on all socials. If you scan the QR code, that takes you to our link tree where you can access current resources, events that we might be supporting, etc. And then, as Jeff mentioned earlier, we have this really rich resource in California called the System of Support for Expanded Learning. It is an entire statewide system that is designed to support regions throughout California within our expanded learning ecosystem. And so you can scan the QR code or click on the bit.ly in our resource doc to learn more about who the system of support is in your region and how you can connect with them for support. And finally, thank you for participating in today's workshop. I know that it included heavy content, real life content, and we really hope that this workshop provided you with at least one takeaway to take back and apply it in your programs or perhaps with the youth and families that you're serving in your community. We do live and breathe a culture of continuous quality improvement. And so if you would be kind to take maybe 3 to 5 minutes, you can do it now, or at the end of this workshop, you can scan the QR code or click on the bit.ly in the chat to provide us your feedback on how today's workshop was for you. What might you want to learn more about? Any tips that you might have for us? We definitely implement our feedback into our future workshops and learning opportunities. So we appreciate your feedback. And we also included this evaluation in our feedback form, so that will be available for folks. And that concludes our workshop for today. Thank you again for participating, and we hope you have a great rest of the day. Take care, everyone.